All right, everybody, welcome back to another episode of Honestly Bilal, the show for the aspiring ophthalmologist. My name is Bilal, and I'm a fourth-year medical student at the University of Toledo. This is Honestly Bilal, the show for medical students who are interested in ophthalmology, residents who are training in ophthalmology, and sometimes I talk to current ophthalmologists in the field. Today, I'm joined by my guest, Dr. Andrea Tooley, assistant professor of ophthalmology at the Mayo Clinic. She is an oculoplastic surgeon and orbital disease specialist. Dr. Tooley did her bachelor's degree at Butler University, followed by her medical degree at Indiana University, followed by her residency at the Mayo Clinic in ophthalmology, and then did her oculoplastic surgery fellowship at Cornell. She is now back at the Mayo Clinic teaching and doing her thing, and it's an honor to be with her. We've done some research together, luckily, and she's been a great mentor for me and others. So Dr. Tooley, it's an honor to be with you. Thank you for joining me.
Oh, well, thanks for having me. This is great. Really great to be here.
Thanks so much. I love the background. Your home looks beautiful. I've seen it on Instagram a little bit here and there.
Thank you. It's a cabin out in the country, and we're having a really good time.
There you go. Yeah, so as somebody from Kentucky, I know the country pretty well, and I think it's a great place to just relax and unwind after a stressful day. So,
Yep.
that's great. So let's start from the very beginning here. I mean, you have an amazing website. You've built yourself quite a foundation with people who are really look up to you and really enjoy watching your story. So, back from the very beginning, your interest in ophthalmology started with you being a pilot in high school. So you actually met somebody at Orbis when you had your pilot's license. So talk about that journey and how serendipity and hard work got you into ophthalmology and interested in it.
Yeah, I did. This is one of my favorite stories to share because it's completely serendipitous how I ended up in ophthalmology. But you're right, I was in high school and I was really interested in science and I was interested in being pre-med. I thought maybe that medicine would be a good profession for me. Of course, as a high schooler, I didn't know anything and I don't have any family members in medicine, so I didn't know what I was doing, but I thought maybe I would want to be pre-med in college. And then I did fly airplanes. I got my pilot's license in college or in high school, and that was just a thing that I did. And so I ended up meeting this pilot at the private airport where I flew, who flew for Orbis. And he told me all about Orbis, and I went home that day and I looked it up online, and it really spoke to my soul. I didn't know anything about ophthalmology, but the idea of being able to help someone with their vision and that you could do that as a doctor, it really, really spoke to me and captivated me, and I decided kind of right then and there, like, this is what I want to do. This is what I'm supposed to do. And so I contacted Orbis, and I think I emailed them, and I also maybe sent them a letter and, said like, hi, I really want to get involved. Like, what can I do to help? And, Orbis is a huge organization. They don't take volunteers lightly. They really don't let outside people come in and help. They certainly don't take high school students. And so it took me about 6 months, I think, of really persistently pursuing them. My mom and I drove down to Memphis, and the Orbis airplane was there at the time, and we met the director and we talked to people, and my whole idea was like, let me come and help, and just I can do all the scut work, I can do like anything, and I don't know how I ended up convincing them to let me go. And people email me all the time. They're like, how do I get involved with Orbis? And I don't know. I was so lucky that somehow they had an extra spot, and they were like, actually, maybe you can come on this trip to Peru. I had to pay my own way. I like raised money. I like asked everybody to sponsor my trip, all kinds of things. Yeah. I think that the moral of the story in that, when people ask me like, how do I get involved with Orbis? I don't know how to get involved with Orbis, but I think that if you have something that you want, you have to just go after it. And sometimes it'll work out and sometimes it won't. There's been all kinds of things that I've gone like all in and then it just hasn't worked out. But that one for me did. And so I went with them to Peru for 2 weeks, and it was the best trip. I got to see so much ophthalmology. I'd never seen a cataract surgery. I'd never seen, anything. And it was amazing. Wow. And I really, really decided then and there, like, I want to be an ophthalmologist. It's over. And that's what I did.
Yeah, and you actually did, and it's over. I mean, that's awesome. So that's a crazy story about how just like really just persisting and keep going. And it's awesome that you did that at a point, and a lot of people don't have that foresight or vision that early in their life. And I think that's really awesome that you had that, and then you just went with it. And something that you've really championed to pre-med students and med students and residents, or just anybody out there through your messaging has been, when you go for something, go for it 110%.
Yep.
and, you know, put yourself in a position where no matter what, you're going to keep beating on the door till the door falls. So, you know, I really look up to you, and I think a lot of people do too, who've watched that journey, and we've really felt inspired by you. So talk about that. You know, you really do a great job of responding to students and really remembering what it's like to be in this position and to try to, you know, do something special in your life and your career for others. And you've really championed that and really put your, you know, put that out there for, you know, when people ask you questions about it, you know, like, how do I do great on the MCAT? How do I, you know, perform well in medical school? Or how do I, you know, be a standout resident, help my other co-residents? And you've always answered questions like that. So what has led you to be a mentor like that? And what is your mentorship philosophy?
Gosh, I mean, I think it all kind of started because I started a blog in medical school. And this was like back before Instagrams, really long time ago. But I was studying for step one, and I was in a really low place. I was so depressed
I think
and
we all
sad.
are.
Yeah, it was horrible. And the highlight of my day was reading other people's blogs.
Mm-hmm.
I had that at that point there were all these like health and fitness blogs that were really trendy, and there are all these like super healthy, cute, fit girls who would blog, you know, what they ate and what their workouts were, and that literally got me through studying for step one,
Hey, yeah,
living
good word.
vicariously through these people's lives. And I kept thinking, you know, I should share my life as a med student. That would be different.
Mm-hmm.
And back then, there really wasn't anyone online in medicine, at least not as a pre-med or like early in medical training.
Right.
And I remember, at least for me, when I was a pre-med in college, it was such a black box what medical school was like or what residency was like. There was just no information online. You couldn't find anything. And if I saw somebody that was in med school, I would harass them and be like, tell me everything, because I don't know, you know? So I think that was, I just kind of started my social media stuff at the right time when there was nobody doing it. And now it's unbelievable, the resources online and the people you can connect with and how much you can find out. And you really can have a good idea of what med school is going to be like and what residency is going to be like. That's so different. It wasn't like that then. And so I think that just by sharing kind of my experience, as I blogged literally every single day through third year and fourth year of med school, and then most of intern year. And then I kind of stepped back a little when I started my ophtho residency, just because honestly there wasn't time, and my priorities had kind of changed. But I think that other people kind of watching me go through that was helpful, I guess. And it was honestly really helpful for me because I found a lot of motivation from other people who were invested in what I was doing, or people who were also in medicine at the same time, or even like I had so many great girlfriends that I met from blogging, and it really enriched my life so much.
Sure.
So yeah, that was kind of how it all started. And then I really kind of transitioned to Instagram because keeping up a daily blog was just not feasible in residency, and definitely not in fellowship. I suppose it could be for some people, but my priorities really changed in terms of I wanted to publish and do research, and I wanted to be more involved in my residency program and things like that. So I switched kind of more to Instagram, and that's been a really fun platform too, to connect with the medical community on Instagram. Is a powerhouse. It's awesome. Yeah. And I love it. And so that's been super rewarding. And in terms of connecting with students, you know, I really struggle because people ask me so many really specific questions, and I have a really hard time thinking that I could potentially like sway their decision. They're like, should I go to this med school or this med school?
Right.
I don't know. I'm not going to tell you that. Yeah. I think some people maybe feel more comfortable like really giving specific advice, and I would rather kind of show what I've done and how I've done and what if it's worked for me, and then maybe other people can customize or personalize that for their life, or if it just helps them feel better about what they're going through. But I do mentor a ton of people. I've had so many really awesome people reach out to me and say like, hey, can I do a project with you or whatever? And they've all been great, and it's been really, really fun. Just, I think you have to remember where you were in every step of the way. Like I remember what it was like when I was a med student, and approaching residents was scary. And then when I was a resident, the fellow I held on such a pedestal, and you know, every step of the way in medicine, it changes. So you have to remember that, and you have to help everyone before you each step of the way.
Absolutely. And I think it's, I mean, it's such a humble thing to do. And it really goes a long way because now, even if you look back about a month or two ago, you started the virtual mentorship program with Dr. Janice Law at Vanderbilt and Dr. Usiwama Abugo. And that has taken off. You had hundreds of responses. I was one of the people who wanted to be in the program, and you hooked me up with a mentor. I got Dr. Andrew Hindershot at Ohio State. So he's actually been a guest on the show now. So I have to thank you for that. So
Awesome.
it's been awesome to see how things can develop like that. And
Man, well, the virtual mentorship program was you.
no,
I mean, really, you were the impetus for this. No, because honestly, I had been struggling with my social media presence and what I wanted to do with it. And, I think we all go through kind of like ebbs and flows in terms of our motivation and dedication for social media because there's a lot to get out of it. But then also, it's kind of a slog sometimes and you feel like maybe you're not getting a lot out of it. And I was kind of at a really stagnant point thinking like, what am I doing? There's so many great people online who are putting out awesome content. And I don't really want to just add to the noise unless I'm really adding something valuable. And I had kind of tossed around the idea of somehow trying to make a mentorship program or some kind of platform where people could come together and all have a community. Right. And it was right then when you tweeted, hey, I'm a fourth year, I'm applying, I don't have a home program, what am I supposed to do?
Yeah.
And it was such a light bulb, like, wow, there's so many of you right now who are going through this application cycle. If I was in your shoes, I would be freaking out because it's so different. You don't have any of the resources that we had with COVID. Your away rotations are canceled. You can't do interviews in person. I mean, it's just crazy. Mm-hmm. And so I thought, let's somehow set these kids up who don't have a home program with somebody who can at least be a sounding board for them, And the only reason it's been successful is because I asked Janice and Usi to join me. And without Dr. Law and Dr. Abugo, it would have fallen flat on its face. But the two of them are superstars. And because I asked them, the whole thing just turned into something really great. We had almost 600 people fill out the survey asking for a mentor.
Wow.
Yeah.
That is crazy.
And close to 200 people volunteered to be mentors.
That's awesome.
Which is amazing. Yeah. And so it's really hard to pair everybody. Sure. And so at least up to this point, we've prioritized the fourth years, and the fourth years who didn't have a home program, they got paired first. And now we're working through all the rest of the fourth years. I think we're almost through all the fourth years. And then we'll kind of keep going from there. But it's been a labor of love, and I'm really glad that you're getting something out of it.
No, that's so exciting. I think if there's any way to connect people, that was probably the best way to do it. And I mean, you connected hundreds of people together. That's just an awesome labor of love, like you said. And again, I think it's why ophthalmology is the best field of medicine, because I've never seen a community come together like that in a time of, confusion and kind of like stress, obviously. So, thank you so much for that. Thank you for always championing for the students. And that's why we look up to you. And I'm sure that people ask questions all the time that it's probably nuts to keep up with, but I'm always impressed by the way that you do it so candidly, and you do it with such a genuine thought, and your answers for your questions are always coming from a place of honesty, and as a channel that's called Honestly Bilal, I think that's something I really appreciate. So keep doing it, and thank you again for it.
Thank you.
Yeah, so let's talk about oculoplastic surgery. I mean, that's your bread, that's your butter, that's your jam. I mean, that's what you do day in, day out. You love it. You're attending the Mayo Clinic now. So tell us your day-to-day at the Mayo Clinic. What is an oculoplastic surgeon responsible for? You're my first guest who's an oculoplastic surgeon. So what is the kind of, the pathology that they're kind of dealing with? What do you love about it? And what kind of person fits in oculoplastic surgery?
Oh yeah, oculoplastics is the best. I'm obsessed with oculoplastics. It is so where I was supposed to be in life. But let me tell you, I didn't know anything about plastics before I started residency. I did glaucoma research in med school. I did ocular oncology research in med school. My main mentor was glaucoma. I did some neuro-op stuff. I didn't know, I had no exposure to plastics. It wasn't even on my radar. I thought I'd probably do maybe glaucoma, but I had an open mind, whatever. And I think like my first week of residency, all of my senior residents were like, oh, you're going to do plastics.
No, really?
Like, what? Yeah. They all knew. And I was like, that's not true. And they said, yeah, for sure. It's like, no question. And they were all right. So I don't know what it was about my personality, but plastics was my first rotation as a first year. So I did it in October, November as a first year, and I loved it. But I thought maybe I just loved it because it was my first time in the OR. You know, you get to suture a lot when you're a first year. It's easier to be more hands-on in plastics as a resident when you're early in your training because you're not inside the eye. It's just, you know, it's a really good starting point.
Sure.
And so I thought, well, I'll keep an open mind for the rest of the year because I thought maybe I'd like cornea, and that was my very last rotation. That I won't really decide oculoplastics till the end of the year.
Okay.
But with every passing rotation, I really realized that that I liked oculoplastics the best, and I didn't enjoy the rest of ophthalmology as much as I thought I would. I love ophthalmology, but I didn't love like the slit lamp exam, which is very important in ophthalmology.
Sure, yeah.
And I didn't love intraocular surgery. You know, it just didn't do it for me. It didn't feel the same as more macroscopic surgery. I didn't like being under the microscope. And these are really things that I didn't know. I liked cataract surgery. It was okay, but I just couldn't see myself doing it for a lifetime. And I really enjoyed everything in residency, but there was nothing that I was like, yes, I could do this for the rest of my life. But with plastics, so one, I really enjoy that it's more macroscopic surgery. So it's not all under the microscope. It's more like regular plastic surgery or any reconstructive surgery. You know, you can see it. The anatomy is more like every other surgical specialty. Suturing's like every other surgical specialty. And then I really also liked two things. One, that there's definitively the most variety in oculoplastics. You know, I think like in glaucoma, you do lasers, tubes, trabs, cataract surgery. So like, you know, there's very small, maybe you do 10 total surgeries. And same in retina, you're going to do vitrectomies and peels and buckles and lasers. And that's kind of like, it's just very small in every other specialty. But in plastics, it's not uncommon for you to do maybe like 30 different procedures.
Wow.
A lot. And then, you know, I have like a textbook that's a atlas of all the different procedures, and there's like 90 in that textbook. So I mean, it without a doubt has the most variety. Okay. So if you like surgical variety, then oculoplastics is definitely for you. If you like bigger surgery, you know, I really like that in plastics we get to use drills and saws, and you get to work with a lot of other surgical subspecialties. I just had a big case with neurosurgery, so you get to do craniotomies. You get to work a lot with ENT and OMFS. And I really like that aspect of it because I feel like it pushes me and kind of expands my knowledge and horizons, and it's just fun. There's a lot of variety that I really like. And then I feel like there's a lot of surgical creativity in oculoplastics. Even with simple things like blepharoplasties or ptosis repair, there's a lot of different ways that you can do it. There's a lot of little subtle nuances. And even if it's a functional surgery, meaning they need it to improve their vision or to protect their cornea or whatever, it's not cosmetic. I still like to approach every functional surgery with a cosmetic mindset. Like, how can I optimize the aesthetics here? How can I rejuvenate the face or bring some more youth to this face, even if we're just closing a defect from skin cancer, or even if we're just lifting lids to make them see better? Like, maybe we should lift their brow a little just because it's a little better. Maybe we should reform the lid crease. Or I really like that I get to look at every procedure a little bit differently depending on the patient's anatomy and what the patient looks like. And oh man, it's just the best. I can go on
definitely love it. Yeah.
Yeah, it is the greatest.
Sure. And I feel like, I mean, there must be an art to it. I mean, there must be there's such a visual nature to everybody's face is different. There's such a balance to everybody's, you know, orbital region. So I'm sure there's an art to it. There's an eye for it. And I'm sure that you must like that part too.
Exactly. I really like that you can, you know, you have to take your time and you have to see what their facial structure is. Do they have very prominent cheekbones, or do they have what we call a negative vector, which means their cheeks are a little depressed and their mid-face is a little flat? And where can you add volume to help? But all at the same time, your goal is to protect the eye, and your goal is to make the eyelids function the way they're supposed to, or you know, protect the cornea or protect the optic nerve if there's orbit stuff. The orbit is a fascinating, very exciting place to operate. It's really fun and really challenging. The anatomy is awesome. Yeah. So yeah, it's good. And I think, you know, like my days at Mayo, so this is my third week in practice.
Uh-huh.
And so I have maybe 3 days of clinic and 1 or 2 days in the operating room per week.
Okay.
My weeks alternate. So one week I have 2 days in the OR, and the next week I only have 1 day in the OR. And then the rest are clinic, and I have an academic day to work on research or whatever.
Okay.
And so clinic patients, it's kind of a variety between people with like really serious bad stuff. So really bad thyroid eye disease that's dangerous to them losing vision and you have to follow them closely, or orbital tumors that need to come out, or really bad skin cancers that it's difficult decision making, or think bad stuff
Mm.
intermixed with very not bad stuff like
Yeah.
droopy lids or droopy brows or a lid that's turning out that needs to be tightened. And so I think that having that to break it up, if it was all like I think ocular oncology would be really hard for me because it's all really high stakes and every patient has like life-threatening stuff. But the fact that I have some serious bad stuff and then intermixed with some like very like we can take off some extra skin and do a blepharoplasty and you're going to love it. It's going to be great. It's more lighthearted. And I think it just kind of makes a nice balance. And the same in the OR, you'll have a couple cases that are really intense and scary. And then you have a couple cases that you're like, this is great. Very low risk for any complications. Like everything's going to be fine.
That's awesome. That's great. I mean, and obviously, going back to the Mayo Clinic, that was a place where it was kind of home for you for 4 years as a resident, and now you're there as attending. So talk about the Mayo Clinic, why it's an awesome place to be. What do you love about it? And who are some people that you really, you admire and want to give a shout out to?
Oh, Mayo is the greatest. Everyone should come visit Mayo. It's such a spectacular place. The Mayo brothers built Mayo Clinic out of nothing. It was their private practice. And they were really incredible people. Their father was the senior Mayo, William Mayo, and then there were two brothers. And the three of them were physicians. And they were so ahead of their time. They were really collaborative. They brought in the most amazing people. They were general surgeons, but they did everything. And they built the Mayo Clinic in the middle of nowhere, Minnesota.
Right.
And that is just such an amazing fact. And really, it's just this incredible culture of collaboration and innovation and creativity. And the fact that it's in the middle of nowhere, Minnesota, and yet it's the #1 hospital in the world is because everyone genuinely wants to be there. Sure. People wouldn't live here unless they really wanted to. And so I think that you feel that every day you come to work and that the doctors there want to be there. And it's such a nice place to work. I'm so grateful to work there. The support that you have on an administrative level and a staff level, I think it's just the greatest academic job. I couldn't ask for a better job in terms of the support and everything. I absolutely loved training there as a resident because, for one, I mean, it's the best institution in the world. And so you get a lot of great support and you're just working in a really nice environment that just makes your overall quality of life a little bit better. And those things matter when you're a resident. But I think also there's a really good balance between working with the absolute experts and like top of the top ophthalmologists and then having a lot of autonomy. Sure. So we do have an emergency clinic. It's just a regular kind of walk-in clinic, like an emergency room that runs every day. And our first-year residents run the clinic, and our third-year residents staff the clinic. Okay. And so you get complete autonomy in the clinic. There's faculty there that you can staff with and that oversee and support you. But in general, those patients become your patients. So, for example, I had a patient that I saw as a first year who had a really bad V1 zoster, so shingles, V1, and then had terrible corneal involvement and then got uveitis, and then the uveitis was so bad that they got glaucoma, and then it was just like this constant horrible thing. And I bet I saw this person 50 times throughout my first and second year, and they were my patient because if you see them as a first year, they're yours forever. And so by the time I was a third year, I got to do this person's cataract surgery, their tube for glaucoma. I had such a close relationship. And then this person literally just messaged me on the EMR and said, "Hey, welcome back. Like, I know you're not glaucoma, but can I still come see you as your patient?" And it's just the most wonderful thing that those are the types of relationships you get to build. And that patient really feels like I am their ophthalmologist, even though I was a resident. And so you have plenty of support. You're not, completely thrown to the wolves. And I think it's a nice balance. There's some residents that are very sink or swim, and then other residencies are very hand holding.
Mhm.
And I think Mayo is a really good balance between those two. You get a ton of support, but you also, the patients are yours. And that makes a big difference because, if you see a patient on call and they have something bad and you don't know what it is, and you say, well, we're going to start drops, and then you need to come back in the morning with cornea, or come back in the morning and see retina, or whatever, that it just completely changes your whole mindset because you're not the one who's going to see them in the morning. And even
Sure.
if you check the chart to follow up and see what happened with them, it's not the same. So at Mayo, you see someone, they have something bad, and you say, come back tomorrow, but they're going to see you tomorrow. And so you can never get rid of these patients. And so you're forced to really learn from presentation to complete resolution of all of these disease courses.
Sure.
And I think the value of that is so underrated and under acknowledged because, as a fellow, I worked with 3 other residency programs, and they're all super strong, like amazing residency programs, but they all still were able to say, follow up with somebody else. And it really changes your learning. I think that the fact that our residents keep all their patients makes them very, very strong, very fast.
That's good. So you really believe in the longitudinal learning aspect of the training, it sounds like.
Yeah, absolutely. I think it's huge. And, everything else about Mayo is great. We have great numbers. The faculty are fantastic. Our program director, Andy Barkmeyer, is a huge mentor of mine, and he really encouraged me to get involved in resident education. And so, yeah, he's fantastic. And then the oculoplastics people are just absolutely amazing. Not me, but the other ones in our department are great. The whole program's great. I would really encourage everyone, if you're applying, consider Mayo. Reach out to me if you have any questions. I can't speak highly enough about it.
That's awesome. And it sounds like, they must be so happy to have you back too. It just seems like a natural fit. By the way you talk about it, it seems like the passion is there and everything. So I know you just moved there. I know that you just got a brand new house and you're adjusting to life as an attending and everything, but tell us about your animals. I see that you have some chickens at the house and you have some beautiful dogs. So tell us about the animals and what do you love about the home life?
Oh man, we're so excited. So we bought a house in the country on 16 acres.
Okay.
And it's so fun. So the previous owners had horses.
Okay.
We don't have horses. We have no experience having any animals, but we did get chickens.
Yeah.
There's a big barn, and there's like an easy place to make a chicken coop. So we kind of made like a makeshift chicken coop. We might make a different one later, but I think it's going to be fine, and it would be very insulated for the winter time. So yeah, we got 5 chickens, and they're so funny.
That's
Chickens
fun.
are really funny animals, but I've been learning a lot. I've been learning so much.
Sure.
And then our neighbor gave us 2 kittens.
Oh, wow.
So we have 2 little kittens that are going to be barn cats or outdoor cats,
Okay.
but they're so cute. They're so cute.
That's awesome.
And yeah, we've been planning our fall garden. I started all my seeds. I really like to garden,
Okay.
and I always wanted to kind of live out in the country and live off the land and grow my own food and have that kind of lifestyle.
Yeah.
So living in New York City was really fun for 2 years, but by the end of fellowship, my husband and I couldn't wait to get out of there and get into the country.
That's true. That's true.
Yeah. So we've been having a ton of fun in the house and doing all kinds of stuff on the land. My husband's trying to decide what kind of tractor he needs to get.
Oh, okay.
It's like crazy.
Big life decisions now. It's just
I know. It's crazy.
That's really cool though. I mean, it's just nice that you have like this, you had an idea of where you wanted to be at and just, the lifestyle you want to have and I think it must be fun just kind of like putting it together now. And I'm sure every day is fun, like with little projects you have on the side of like the house or the farm and all that stuff.
Oh yeah. Every day there's so many projects.
Yeah.
We had somebody come to the house because we did a few little small renovation things, and they said, well, I think you have enough projects to last you a lifetime. I said, yeah, I think that's probably true.
Well, that's fair. I mean, you're a busy person. So, I mean, that says a lot. I feel like I need to up my game and just make my apartment more clean. So now I need to.
No, you don't. It's whatever, everybody has different hobbies. Everybody likes to do different things on the side. And when I come home, I don't do work. I do work at work.
Yeah.
And I was kind of the same in fellowship. When I would come home at the end of the day, I would try really hard not to do work and just be with my husband and my dog. And so same thing here. When I'm home, I'm not working and we're doing home stuff. And that's like cooking or gardening or playing with the chickens. Who knows?
That's true. Yeah, all five of them.
Yeah.
Dr. Tooley, it's been an absolute pleasure. And it's an honor to be with you. I'm so glad I've gotten to know you a little bit here and there throughout the last few months, and you've been just a genuine soul and person who's been willing to give back to everybody. So thank you for all you've done. Thank you for the mentorship you've been giving. Thank you for your portrayal of what it's like to be like on the training side and then after training. And I think that's something we all need to keep in mind. And we're looking forward to learning more from you as you go on your journey and hopefully to watch. So is there any way that you can share your Instagram and Twitter handles for people to follow you if they haven't already?
Yeah, of course. My Twitter is dr.Andrea Tooley, Dr.Andrea Tooley. And then my Instagram's just Dr. Andrea Tooley, Dr. Andrea Tooley.
Awesome. Dr. Tooley, it's an absolute honor. And if you're out there and you're listening to this and you're listening to the podcast or watching the video channel and you're a med student or you're pre-med or anybody who's just interested in ophthalmology just a little bit, try to like, comment, subscribe, and see if this channel is anything that can interest you. I'm not anything but a med student right now, but hopefully as I go along my journey, you learn a little bit and can get something from it. So looking forward to sharing more about of these perspectives from people who have done a lot more than me and have a lot more wisdom than me. But it's great to talk and sit with them. And looking forward to the next one. So we'll see you on there. Bye bye.